Why would someone prescribe cannabis for that? What did it do for the child with that condition?
Okay, well, the first thing we have to explain that we do not prescribe
Oh, okay.
medical cannabis in the United States, and I'll explain why. No, that's a very, very good.
Sure.
That's a good mistake you made because it's a great segue. As
It was
physicians,
intentional. That was all intentional.
as physicians, we cannot prescribe a Schedule 1 drug because it's a violation of our DEA. So we use our First Amendment right of freedom of speech, where we recommend to patients the use of cannabis.
We're not prescribing it. We're just saying, here, you can go and you're approved to get it from a dispensary. Is that accurate?
Right. Here's a recommendation.
Recommendation.
Here's a recommendation. And with that recommendation, you're free to get your medical cannabis. Therefore, that 15-year-old child that received his medical cannabis, it was mainly to help his pain level, because when he started with me, he was on a pain pump, a morphine pain pump, and was receiving 16 milligrams of morphine via bolus every X amount of hours. And once we incorporated the use of the cannabis, he was able to lower the dose from 16 to 8. And by doing so, it then gave him a better quality of life, because now he was awake and alert. At 16 milligrams every 2 to 4 hours, he was laying in his hospital bed, drooling, looking at his crotch. But by being able to wean him off of it, it managed his pain, but it opened up his appetite. He was able to eat, and he was able to leave his bedroom and participate with his family.
So it gave him a quality of life that he would not have had had he not taken it.
Correct.
And it obviously didn't really fix anything that was going on. It was just a way to tolerate the pain that he was going through. Is that correct?
Right, because again, it opens up your appetite, and we've known about that. And conventional medicine has known about it for years because we've used Marinol, dronabinol, and the FDA approval for that is for HIV/AIDS patients with wasting syndrome, patients on chemotherapy, that have anorexia, as well as for the nausea and vomiting related to the chemotherapy.
Perfect. Okay.